Welcome back to NYIT's Roundtable. I'm Denise Moore. Today we're discussing Alzheimer's disease, and I am joined again by Dr. Dennis Kodner and Dr. Tobi Abramson here at the New York Institute of Technology in Old Westbury. So now let's get back to talking about the people at home that are taking care of their loved ones with Alzheimer's. Is there help for them?
In terms of managing the challenges, yes. Caregivers, when they're involved in it, have a very difficult time realizing that there are support services out there to help them cope with their, whether it's the day-to-day struggles, whether it's the emotional consequences, the challenges, the burnout that exist. There are caregiver support groups, which for many people are very beneficial, giving you an opportunity to talk about the issues, the struggles, your feelings of loss, of grief, of sadness about your caregiver, your care recipient, and what you're struggling with. So I would clearly suggest to caregivers to call their local chapter of the Alzheimer's Association or the Alzheimer's Foundation and find out where there is a support group for them. Not everybody feels comfortable going to support groups, so there are one-on-one counseling by mental health practitioners, which can be very beneficial. People sometimes come with their families to a counseling session, but being able to talk to somebody, sometimes outside of the family, is really very helpful. And caregiver support groups are a wonderful way to understand that what you're going through is not unique, that other people are struggling with the same types of issues, and learning strategies to sometimes be able to better cope with them wandering in the middle of the night, or where to put a lock on the door so that they can't open the door and just walk out in the middle of the night, and learning those tricks. Caregiver support groups also provide information, provide access to services, provide very concrete kinds of information as well. So I really do recommend that people find out what's out there by calling their local chapter or going online to the Alzheimer's Association, the Alzheimer's Foundation. There are tons of services here on Long Island and throughout the country. These are nationally based organizations. Talking to your medical practitioner if you are really stuck and don't know where to turn. But nobody should provide care alone. That's the fastest way to burn out, and the one risk is that you will become so ill yourself you won't be able to provide the care for the care recipient, and that's really your goal. So learning how to take care of the caregiver becomes important.
Right. Now also I could see another problem might be, now you're a child and you're taking care of your parent, so now your roles reverse. That has to be very challenging as well.
You know, I always struggle with the concept of role reversal because they're still your parents, no matter how old you are. Yes, you're doing more care, but they're still your parent, and so all of those issues about, for instance, toileting. Taking your parent to a bathroom and toileting them and cleaning them up still violates a lot of cultural and social norms for us because they're still our parent. It's not like taking care of your child and diapering them. So yes, there are role changes and there are roles that adult children will take over, but it's never a full role reversal.
Right. Now, let's get back to the long-term facilities. Are they working?
Well, I think that we have an enormous problem in this country. People with Alzheimer's and related dementias are part of a larger group of Americans, about 10 million Americans who need long-term care, whether long-term care is provided in the home or a community setting or in institutions like nursing homes and assisted living facilities. We spend about $200 billion a year providing care, whether the money comes from out-of-pocket, family members themselves, or from private insurance or from Medicare and Medicaid, two major public programs. Despite this enormous expenditure, we have major shortcomings in the system. We're the only industrialized country in the world which does not cover, from a public point of view, the cost of long-term care. So people actually end up pauperizing themselves, providing for the care they need. The second is the system is a very, very complex one. Services provided by medical facilities, by healthcare organizations, by social service agencies, by human service organizations, mental health providers. It's a very complex system, very fragmented, very uncoordinated. And as a result, it's very difficult to navigate the system. So families have difficulties in accessing services and navigating services. And last but not least, one of the biggest problems is the lack of people to provide the services. We have a tremendous shortage of direct care workers, people like nursing assistants, personal care workers in the home, in the nursing home, to provide the care. Who's going to provide us care when we're old and gray, whether you have Alzheimer's or not?
Right. Wow. I read somewhere that there are at least 9.9 million unpaid caregivers in the United States. So again, you have these people that are taking care of these, their loved ones, and they're struggling. So I guess getting the word out that there are services is so important, so they know that they have someone to help them. Do you have any advice for caregivers this holiday season?
Learn how to ask for help. Better yet, learn how to accept help. Very often other family members are only too eager to help but don't know what to do or how to help, or don't know how to come and visit during the holiday season, which further isolates the caregiver. So it's really important to, as you're making up your list of holiday cards, to put on your list, respite, come sit with my loved one for an hour, bring me a cup of tea, talk to me. So much is about the care recipient, but people have to remember that the caregiver is there too. And this time of year, social withdrawal becomes really even greater. So I think being able to having caregivers be able to attend to their needs, ask for help. If they've always loved decorating their house, they should still do it, but then ask a family member to put the decorations away at the end of the holiday season.
Why do you think it's so hard for people to ask for help?
I would say that there's a lot of socialization and cultural norms about being independent, especially as you're getting older, doing it yourself, looking like you've failed if you ask people for help. We feel like we should be able to do it ourselves. But caregiving is the most effective when we use all of the supports, our family, our friends, our religious community, to really help buffer. Everybody needs respite. You need a break. Sometimes you just need to be able to sit down by yourself. And because of the disease, you may have a person who follows you around even to the bathroom, and you may never have that 5 minutes to yourself. If we don't recharge our battery, we know from us as non-caregivers, we have to recharge our battery. Caregivers need to recharge their battery. And during the holiday time is really particularly important to be able to accept the offers.
And there's an enormous stigma involved, I think, for certain people. In certain cultures, having Alzheimer's or dementia is, for example, Asian community, people consider it quote-unquote crazy. And people don't want to admit that they have someone in the family who has Alzheimer's or dementia. They don't want to suggest that they need help because that would kind of expose them to the community, the ridicule of the community.
Okay, well that's all the time that we have today. I want to thank you both for joining us. Thank you all for joining us, and we'll see you next time on NYIT's Roundtable. I'm Denise Moore. Thanks for watching.